this first video conference. Dr. Thueroff, thank you very much to be here with us.
Hello, Mauricio.
How are you?
Thank you. This is Stefan Thueroff from Munich, Germany calling. I want to thank you first for the invitation to participate on this video conference. I have been, as you know, twice to Santiago to participate on conferences like the SIU or the Symposium HIFU. And I want today present our newest data and my personal experiences about 15 years working on high-intensity focused ultrasound for the therapy of prostate cancer with the Ablatherm device.
Okay, well, I'm going to make a first short introduction of 5 minutes, and after you can explain what your experience. Okay? Bueno, primero agradecer a los presentes. Este es un trabajo de la primera videoconferencia mundial sobre el HIFU, y que contamos con probablemente los dos personajes más significativos en el tratamiento con HIFU. El doctor Gelet, creador de la máquina del HIFU, y el doctor S.THUROFF, quien tiene una de las más grandes experiencias con este tratamiento. Además, tendremos posteriormente un panel en el cual también participará Royce con su experiencia sobre el HIFU. Nos hará una pequeña introducción, luego el doctor Thueroff hablará sobre su experiencia, posteriormente el doctor Gelet, y habrá una mesa redonda. El doctor Thueroff trabaja es el jefe de Tecnología en Munich, va a hablarnos sobre el tratamiento local de la terapia HIFU, el tratamiento de Salas y el tratamiento paliativo durante con HIFU. El doctor Gelet nos va a hablar sobre el HIFU de sabotaje por radioterapia, tanto terapia focal como global de la glándula. Dos palabras con respecto al tratamiento HIFU. La idea es que se efectúa un ultrasonido de alta intensidad que es focalizado en un punto específico de tratamiento. Esto es 10 veces mayor que la imagen que se utiliza habitualmente en el ultrasonido. Esto permite, con el principio de Arquímedes, focalizar la energía en un punto muy específico y genera una lesión específica. La suma de estas lesiones elementales permite tratar un volumen, como lo ven aquí en la imagen, de manera altamente precisa. Acá tenemos unos estudios efectuados en pacientes en los cuales se efectuó el HIFU, posteriormente una prostatectomía radical. Ustedes pueden ver ahí en negro la precisión del impacto HIFU. Este trabajo efectuado a través de Lyon, el Hospital Edouard en INSERM, con el doctor Gelet a la cabeza, generó máquinas progresivamente evolutivas, llegando hasta la actualidad a la máquina Ablatherm con el control de imagen integrado y control en tiempo real del tratamiento HIFU, que permite tratar directamente las lesiones, solamente la lesión, viendo permanentemente el efecto sobre la próstata. El tratamiento HIFU las recomendaciones internacionales en cierto grado son conflictivas. Ha sido aceptado por la Asociación Francesa de Urología, la Asociación Italiana y la Asociación del Reino Unido. Han aprobado el HIFU como tratamiento primario y el tratamiento de sabotaje en el cáncer de próstata. Las indicaciones habituales son desde 2007 en pacientes mayores de 70 años con estadio T1 o T2, NC20, PSA inferior a 15 y un piso inferior a 7. Y también se usa como tratamiento de sabotaje o la post-falla de radioterapia. A partir de 2010, las recomendaciones de la ALEMANIA la consideran como una alternativa en el tratamiento de fallas de radioterapia. Los controles pueden ser efectuados ya sea preoperatorio, como lo vimos ayer con el sistema de LEVOVIS, SONOVIEW, o a través de resonancia magnética. A partir del día 2 se ve una zona necrosada a nivel de la próstata. En cuanto a la biopsia de control, a partir del día 2 vemos una necrosis de coagulación y a partir del día 90 una complicaciones se manifiesten como una fibrosis. El tratamiento Ablatherm tiene más de 16 años en la actualidad, empezando primero con los estudios en los años 90 en animales, posteriormente los estudios clínicos en la época de los 90 hasta el 2000, estudio de la exposición a partir del 2000 y en la actualidad tenemos más de 23.000 tratamientos. Dejo ahora la palabra al doctor Thueroff, que nos va a contar su experiencia en Alemania.
Thank you, Mauricio, for this introduction. So, I'm a public urologist in Munich, Germany, and I'm working now since 15 years with the Ablatherm device. Next slide. The HIFU technology by Ablatherm went through a very significant and interesting technological development in the France guided by Albert Gelet. As you already heard, it started in the early 90s and it started with a prototype I see on the left hand on the slide. Hopefully you can see you see it on the left. It was an experimental treatment. And in 2000, the machine was available, which was already CE marked. Still, the application was quite huge, which limited somehow the device. Still, no real visualization. Still, there was no roboticism. All this was introduced in the year 2005 with the integrated magic. Next slide, please. This device was the first time a surgical robot. You might think Da Vinci is a surgical robot, but the HIFU by Ablatherm is much more than this. It is an intelligent robot because under the treatment it measures all the movements of the prostate and respiration and reacts in a way that it is size plus 1 millimeter of the target area. At the same time, at the hospital in Lyon, different softwares were developed respecting the qualities of the prostate. Simply, a primary prostate is different in tissue quality to a radiated prostate. And by this development, efficacy were really quality. Next slide, please. But we learned in the first years that HIFU sometimes it creates side effects like obstruction, urinary tract infections, or incontinence symptoms. So this had often followed by a transurethral. This transurethral resection was done to debulk necrotic and to bring the patient up at victoration. We saw that the treatment is effective if the TOR was 4 by medullary abscesses or big adenomas. So this TOR side effects after HIFU and mobilize them to an optimal size for the Ablatherm device. These items, of course, the PSA value already was in R. As you see in this study we performed in the year 2000 to 2008 in more than 1,000 patients, you see that the variant was reduced from 34 cc by QR, and in the second step reduced from 20 by HIFU, resulting in a PSA 0.1. Next slide, please. To get this good efficacy of HIFU, there are, which are absolutely managed, which are correct positioning of the patient on the device. Next slide, please. And which are a standardized procedure for the whole person. This procedure is extremely simple. And one, you can an internet-guided training course for the Association of Urology, because HIFU provides education online ablatherm course, which is accredited. Anyway, the procedure is very standardized, well trainable and learnable, and it's very good and comfortable for the patient, because the patient is spinal anesthesia and 2 hours of time. Next slide, please. It's well tolerable by the patient, because most of the side effects of HIFU occur. In more than 15 years, a patient with emergency surgery, we never had a bacteria or blood transfusion. We never lost a patient in peri or post-operative phase. And we can continue here, but the most important we did not influence negative in the oncological part of the cancer. If prostate cancer returns after all therapy, it was not more aggressive, which happened most after radiation therapy or hormone ablation. Next slide, please. As we can avoid significant side, we can even present a very simple follow-up. The patient after HIFU therapy receives for about 1 week. If he had a resection before, he will have 2 to 3 days catheter time. And in follow-up, his PSA goes more or less every 3 months. We perform biopsies, scans every biochemical relapse or any suspicious prostatic follow-up. Next slide, please. All classical therapy have their indications. In the following slides, I want to show you that the indications for ablatherm or robotic HIFU are much larger than the classical. As you can use it until systemic therapy. Next slide, please. This absolutely overloaded slide just should show you that a lot of research is going on. So localized prostate cancer is studied in huge studies in France and Germany with more than 500 studies already recruited. We perform studies at 12 and castration-resistant cancer and present data of 10 years old. Salvage HIFU after radiation is a topic of Albert Gelet, he will present you afterwards. And surgery failures, as well as combined radiation and surgery failures, are studied and I will present you interesting results for prostate cancer which are in Munich and Salas. Next slide. But first of all, results for the first group of patients, elderly. with low prostate cancer. We are submitting this with 704 patients, which underlines and shows that identified orthopedic study conducted from 1993 to 2000. The difference that in our study a little bit deeper with 0.1 and follow-up was longer. Most important for me is that efficacy and side effects in both studies are very similar, and that in the years came down to 15%. Next slide, please. Important for me is that today we can say, after these 2 long studies, that 2/3 of our T1, T2 patients remain disease-free after 10 years, and 3/4 of all of these ain't without treatment. I think these are really excellent results. Next slide, please. To study prostate cancer, it's a lifelong discovery. To define earlier success, we need surrogate parameters. And in both studies we could show that PSA nadir is the deepest PSA after therapy, an excellent surrogate parameter for cure. And we could show that patients who reach a PSA nadir below 0.3 had a highest for cure after 10 years. Next slide, please. But do we need to call it RV for HIFU in 1 session, or should we do it in 2 sessions? As well, here we conducted a study and we could show that splitting PUR and HIFU reduces side effect by 50%. It has excellent decrease, it shows excellent decrease in tissue sludging, in urinary tract infection prevention, and in catheter time. We could even show that it does not the rate of lateral stenosis. Are we struggling with that? Next slide, please. Incidental prostate cancer is rare but well known in urology. Again and again after resection you will find cases undetected prostate. What to do with those cases? On one side, the guidelines tell us. On the other side, patient higher therapy. In this study with 65 patients over 10 years, we showed that OR is extremely effective and brings down the PSA nadir to values of 0.07 with an increase of 1 per year, which results in cure for the patient. HIFU is the only therapy for prostate cancer after cure which profits in fact of heart. Next slide, please. But one of the most group we have to increase are the patients with a locally advanced disease. Until today, they are not real topic, local therapy. We studied 150 patients in 10 years now and show that a local adjuvant therapy in those patients has a big advantage for them. We could increase the PSA value down to a PSA nadir of 0.28. And we could demonstrate a PSA velocity afterwards of 0.26 per year. This without any ablation. So those patients in still 93% of the cases without ablation. So big question for the curve still open. It simply shows the capacity tumor developing in a multimode concept for the like this. Castration-resistant prostate cancer today is subject to chemotherapy and types of anti-androgen therapy. In a prospective study of 56 patients, we could demonstrate that adjuvant tumor developing has a high effect on those people. We saved more than 2 years patients. They needed, after a decrease to 0.9, more than 2 years to come back on the entry level of PSA. Next slide, please. One of the big futures of HIFU will be focal therapy, and I'm sure that Gelet will tell you a lot about that. Focal therapy was introduced in the US for in-private surgery, and we are just following. We could show in the studies with the low blood prostate cancer that the low lesion, low volume prostate cancer can be treated well and without risk local therapy. And few centers do this already since years. From 2011 on, studies will be conducted in US, France, and Germany. Study back. And each and every year, a conference regarding this topic is active. Finishing a few weeks ago in Amsterdam. Next slide, please. If you speak about it, you should not speak only about efficacy as well about side effects. And if you compare published side effects of classical therapies to the current HIFU therapy, you can see that there are no severe side effects connected to HIFU therapy, that the fistula rate is extremely low, and that our stenosis and a rate of maybe 15% urinary stress incontinence. Next slide, please. So, coming to an end, I want you to remember that HIFU by Ablatherm, transrectal therapy, its focus, pulse, robotic, and G application body. And in this design of the Ablatherm device serves only for prostate cancer therapy. Still at the moment, we need for HIFU to prevent side effects and increase efficacy. We know today that after 2/3 of the treated low blood biopsies are big. 3/4 of the treated patients are without this. And we know by a survey conducted in our hospital asking 1,000 patients that it is well accepted. There are 93% would do HIFU again. So I want to thank Thank you very much.